Hi, my name is Punam Punja. I'm a PA at Emory Healthcare in Atlanta, Georgia. I've been practicing as a PA for over 15 years, primarily in general hepatology. Today, I'll be talking about misconceptions about liver health. One of the biggest misconceptions is that cirrhosis is not reversible. We've now learned that early cirrhosis could potentially be reversible depending on what led to the underlying scarring. Another misconception is that if my liver enzymes are normal, I don't have any underlying liver disease. That's not true because patients that have cirrhosis can have normal liver enzymes, but unfortunately, they have scarring in their liver. Another misconception is that once you have any underlying liver disease, you can't take acetaminophen. You can actually take acetaminophen even with patients that have advanced fibrosis up to 2 grams a day and not cause any underlying liver injury. Another misconception is that my liver is fine because I have no symptoms. I usually tell my patients that by the time you develop symptoms of underlying liver disease, you probably have developed cirrhosis with portal hypertension. Another misconception is that once you have cirrhosis, you automatically need a liver transplant. There are many stages of cirrhosis, and if it's early on, there's a potential of that liver disease being stable for many, many years. Another misconception is that liver cleanse supplements will help clean my liver. This is not true. Unfortunately, we've seen that some liver supplements can cause a drug-induced liver toxicity. Another misconception is that the only causes of liver fibrosis are due to viruses and alcohol. As we know, steatosis, metabolic dysfunction-associated steatotic liver disease is one of the more common causes of underlying liver disorder. Only overweight or obese people can develop steatotic liver disease, which is also not true. There's many metabolic risk factors where patients that are not overweight or have a history of obesity that can still cause steatosis in the liver. And the last misconception is that if I'm found to have hepatitis, I am contagious. Hepatitis just means inflammation in the liver. Viral hepatitis is contagious, but patients who get a diagnosis of autoimmune hepatitis are not contagious. It just means their own immune system is affecting the liver. Thank you for joining me for the misconceptions of liver disease. Please visit GAP MASLD Community Network for any further information. Thank you.